Good evening everyone, I am James from the Department of Quality Assurance, Krupanidhi College of Pharmacy. Along with me are my fellow researchers Dr. KUNTAL and POOJA. Together we worked on formulation of oral dissolution films using aqueous extract of clove, cinnamon and stevia for dental treatment in diabetic patients. Oral dissolution films have gained a lot of importance in the recent days compared to the conventional dosage forms. It has a lot of advantages: lower the disintegration time, earlier will be the release of the active principles, and sooner will be the onset of action. With this, I'll move on to the objective of my study, which is to develop ODF using aqueous extract of clove and cinnamon for their analgesic and anesthetic indications, and aqueous extract of stevia as a 0-calorie sweetener, and also for its antimicrobial indications for dental treatment in diabetic patients. What are the materials and methods? Eugenia caryophyllata crude drug, clove, for its anti-nociceptive or analgesic activity and anesthetic activity. Cinnamon, Cinnamomum zeylanicum, for its anti-nociceptive, antimicrobial, anti-ulcer and anti-inflammatory activity. Stevia rubardiana burt, for its antimicrobial and for it being used as a nutraceutical. All these crude drugs were extracted using water. The active principles from them were extracted using water using Soxhlet apparatus. After extraction, we had gone for active principle analysis or chemical analysis, during which we found that aqueous extract of clove had eugenol, eugenol acetate, beta caryophyllene, sequesterpine ester and phenyl propanoid. Cinnamon had cinnamaldehyde, chalcones, oligomeric propananthocyanidin. Stevia had stevioside, rubardioside. This chemical structure of eugenol, cinnamaldehyde and stevioside are all mentioned here. The formulation, moving on to the formulation of the films, I have used the extract in different concentrations in 4 different formulations, and added to that will be the excipients which are xanthan gum, guar gum, which are used as stabilizers, HPMC, E50 which are thickening agent and suspending agent, carrageenan as a stabilizing and viscosity increasing agent. Pullulin is one of the most important excipients in this formulation because it is helpful for film forming ability. Tween as a surfactant and PEG as a plasticizer. Now, what method exactly did I follow for it? Solvent casting method. Polymer, we had taken 2 different beakers, beaker A and B. Beaker A had solution of polymer with solvent, which is water. B had drug with other additives and water as solvent. They were both mixed separately, and beaker A was added to B. Contents of beaker A were added to B, and then they were subjected to rotation at a specified RPM at a specific temperature until they got into a clear homogeneous solution. They were then poured into the Petri plate, and once dried, they were cut into desired shape and the size that was required. Moving on to the results of the formulation. These are the formulations that I obtained. You can see for F1, F2, F3 and F4, and those were the ones when I cast it for drying. The results, I have done the analysis of organoleptic properties as well as the film properties. Now moving on to the organoleptic properties, the results that I obtained for the color, odor, taste, sensation and surface texture I have shown here. Among all of them, formulation 2 showed better organoleptic properties. Moving on to parameters of formulated films. The first one and the main one being disintegration time. 58 of formulation 1, formulation 2 56, formulation 3 58, formulation 4 57. The lower the disintegration time, earlier will be the release of the active principle and sooner will be the onset of action. So formulation 2 gives one of the best results here. And I do not have time to explain all of them. Moving on to one of the other major aspect, which is moisture loss percentage. More the moisture, more are the chances for microorganism to grow. Lesser, the better is the formulation. So even in that, formulation 2 showed better results. And the others, tensile strength and percentage elongation, folding endurance, are all the other parameters to be considered for film formulation. Moving on to the graphical representation of the data that I received on analysis of the films, you can see the disintegration time, folding endurance and tensile strength. Based on all the above results, we optimized formulation number 2 because it showed better desirability compared to the other formulations. The result was confirmed by Pareto statistical analysis, which is showed here. You can see the formulation number 2. Moving on, FTIR reports. FTIR study was done as a pre-formulation study, and then it was mainly done to find out the interaction between the drug and the other excipients. So these are the FTIR studies of clove clove extract, and then cinnamon extract, and pullulan polymer, and then aqueous extract of stevia, and then the formulation. These are the extracts that we sent. And then it was found that drug and excipients as well as pullulan had given us, we observed these values COOH and NH touching, which fell in between the range of COOH and NH. No appreciable changes in position and intensity of the peaks, indicating that there is no interaction between the drugs and the polymers. So with all of this, I would like to conclude saying that the overall study revealed that the ODF containing analgesic, anesthetic and antimicrobial principles showed satisfactory formulation requirements and was therapeutically aesthetic enough to be considered for administration in diabetic patients. These are some of the references that I have given from my work. Thank you.